I know you've got a big event coming up with Leslie Fletcher. Give us some details on that, because I feel like that opportunity right there alone is just to see you and Dr. Alexander Rivkin together and Steve Weiner, all three of you in one place, is just, my goodness, like a bang for your buck. It's crazy. So tell us about that course and how you kind of ended up with that, and give us the details about how to get registered for that class.
Very exciting. I have so many courses coming up. And so please go to my Instagram and there's a link there, or go to my website. All the courses are listed there. So there's so many of them. And if you want to register, that's the way to go. Believe it or not, I met Leslie at your course last year when I was helping with the Cadaver course. And she came up to me and said, you know what, she was listening to me. She says, you know what, the way you talk about how to do anatomy is really interesting. Would you like to do a course in my training center? And as you know, and the listeners who are listening, Leslie Fletcher became #1 training center in the nation. Right? She won that title. So she is absolutely amazing when it comes to setting this up. I went and visited her place. She's in LA, in Torrance, close to me, and beautiful center. I mean, this is beautifully set up for something like what we're doing. And so we had a great talk, and she wanted to do a very, very detailed course. And I told her that's the only way we should do it. So it's all day from 8 to 5. Not 2 hours, not 60 minutes, 90 minutes, it's all day. And I told Leslie that we're not going to do any surgical stuff. I like to do it in a way that every point that we make in this course can be applied on Monday morning. The course is on Friday. On Monday morning, when they go back and inject, they can use that little anatomy that I showed them about the forehead complex for their neurotoxin injection, the nasolabial fold for their filler injection. And again, it's a filler guided anatomical dissection. A filler and injectables. And the way we've set it up is that the cadavers are already dissected. So we're not wasting time dissecting, because, face it, a lot of the, especially the ones that aesthetic providers that are nurses and PAs, and they don't need to do dissection. It's unnecessary for them. They just need to know where the needle goes in there. Where is that GPS to take him from my office to the bank that we talked about? They need to know the streets and the stop signs. The blood vessels are the stop signs. So, they need to know where to stop and when to make a turn, and when to make a U-turn and come back. So that's what we're going to focus on. So I want to create this imagination in their head that when they put the needle underneath the skin, now they have this engraved in their head that, oh, okay, I just hit this mass, I hit this muscle, now I'm in the pre-zygomatic space. Here's the facial artery close to the tip of my cannula based on the anatomical understanding that we've had. I want that engraved in their head, so when they put the needle underneath the skin on Monday or Tuesday, when they go back, they know exactly where they are. So they have the GPS in their head. So that's the course with Leslie. It's all day, a lot of details. We're going to dissect the entire face, starting from forehead to eyebrow, eyelids, nose, tear trough, mid face, nasolabial folds, upper lip, lower lip, chin, cheeks, lateral jaw, temples, parotid gland. How to avoid it. How to create a more lateral jaw, platysma. We even talked about neurotoxins for let's say people that have excessive saliva getting into the submandibular gland, parotid gland. Neurotoxins for pain and TMJ issues. So we're going to dissect out all those muscles, and it's already dissected, show how to inject those muscles. So it's a tremendous course. It's on March, let me see the date, March 4th on a Friday. I think we have a couple more spots left. If you're interested, go through my Instagram or website, or go through Leslie Fletcher's. I've invited Dr. Rivkin, who's a very, very good friend of mine, and he's a phenomenal injector. He's got very fantastic techniques on how to be safe. So he's going to be helping in the course as a faculty. And I have some of my nurses and PAs in my practice that have been doing this with me, being there just to help everybody. So as opposed to one of the courses where you go, there's 100 people sitting there and you just lost, my course is very specific, because at every station I have an expert to make sure that you're navigating through this filler injectable guided anatomy from A to Z, so you're not lost and it's efficient. So we have Dr. Rivkin, who's there, and a bunch of my help in the office. And then we have Dr. Weiner the next day that's talking about ultrasound anatomy. So it's a very, very unique course. And I think those of you who are in LA or want to come from outside LA, please sign up for it. And